This may sound alarmist. Just when you thought that nightmare was over and the mask could be thrown away, alarm bells have been clanging again with a dreadful insistence. Scientists from the fringe to the mainstream are predicting that a new wave of the Wuhan virus could soon bring back the horrors of 2020 magnified. We don't know when, we don't know how, but we do know the origins. China. And we are being told the consequences now. I don't say this without reason. Over the last 3 days, a host of universities, researchers, scientists, even the US State Department, they've all warned that China's COVID surge could spill over to the rest of the world. So tonight on Gravitas, I'll take you through these warnings. We'll dissect the predictions and assess the risk of a potential horrific new wave. I'll start with a warning issued by this gentleman, Eric Fiegelding. He's an American public health scientist who heads the COVID task force. At the New England Complex Systems Institute, this is a think tank in Cambridge, United States. In January 2020, he was one of the first health experts to sound an alarm over the Wuhan virus. He said that COVID-19 could be catastrophic. He called it thermonuclear pandemic level bad. Once again, these are his words. He was slammed for spreading hysteria, accused of crying wolf unnecessarily. The rest, as you know, is history. It's 2022, and COVID is alive and kicking among us. 35 months, 600 million cases, and 6 million deaths later, this scientist has issued a similar warning. He says the current COVID surge in China is thermonuclear bad yet again, and could soon spill over to the rest of the world. Sound familiar? Deja vu, perhaps. He has also given some numbers. He says 60% of China's population and 10% of the Earth's population could get infected in the next 90 days. What about deaths? The scientist says that they could likely run into millions. Now, I know what you must be thinking. These are just predictions by one scientist. But then again, this is not a standalone prediction. There are others with similar warnings, and they're worrying to say the least. Take this report, for instance. It's based on data from the University of Hong Kong. Professors there say the Wuhan virus could kill more than 1 million Chinese. 1 million. If the country fully reopens by January next year. Look at this report now. It was carried by the NPR. It says COVID is spreading faster than ever in China. More than 800 million people could be infected this winter. This is based on estimates by researchers at the Yale University. Take a look at this headline now. It was carried by Bloomberg. It says the COVID outbreak in China has worried scientists about new variants, about new virus mutations all over the world. In fact, the CDC, that is the US Centers for Disease Control and Prevention, says it's already on the lookout for new variants. Like I said, deja vu. And by the way, health officials are not alone in raising alarm. Even government officials are issuing warnings. Take this one, for instance. It's from Ned Price, the official spokesperson of the US State Department. He says the toll of COVID in China is a major concern for the rest of the world. He has also added that the COVID wave in China has the potential to mutate and pose a threat everywhere. Exact words spoken.
The toll of the virus is of concern to the rest of the world, given the size of China's GDP, given the size of China's economy. It's not only good for China to be in a stronger position vis-a-vis COVID, but it's good for the rest of the world as well. The United States continues to be a leading force for countries around the world in the provision of vaccines and helping countries overcome the acute phase of the virus. We certainly hope that will be the case before long in the PRC as well.
So what do we make of this? How do we perceive these warnings? To answer these questions, we'll have to take a look at what's unfolding in China, understand the scale of the crisis and its potential to spill over. I'll start with these images. They're from the Chinese hospital. It is overwhelmed with patients currently. Morgues are filled with dead bodies, and yet there's no official word from China on hospitalizations. It maintains that not more than 7 people have died in the last few weeks. How then does China plan to explain these images? They're from a crematorium in Beijing. There are funeral vehicles here. As far as the eye can see, there are relatives of victims dressed in black from head to toe, desperately waiting for their turn to arrive, and when asked about their plight, all of them refuse to speak. China also maintains that the caseload is falling, that there are very few fresh infections. Then what explains these images? They are from Beijing. These are delivery workers crowding outside pharmacies, waiting to collect medicines. They say they're picking up multiple orders because loads of people have tested positive. You must listen to this.
The reopening has been slightly burdensome. It's a bit of a burden to suddenly reopen when the supply of medications was not sufficiently prepared.
I am not worried. Anyway, the people around me, loads of them are positive, but I'm not positive yet. I've been taking vitamins.
Look at these images now. They're from Shanghai. They show the city's residents lining up outside fever clinics, trying to buy urgent medication. The queues stretch for several meters, with people waiting in line for several hours. These are just a few images that could make it beyond China's censors. Who knows how many more are stuck within the great Chinese firewall? That said, there's no dearth of official statements flowing in from Beijing. Chinese health officials are doing regular pressers, downplaying concerns about the situation. No surprises there. And of course, the possibility of new variants.
It is relatively unlikely that it will increase both its contagiousness and lethality at the same time. Will a new strain of both greater transmission and lethality appear? This possibility is even smaller.
You think that's bad? Then wait till you hear this. China has changed the criteria of what's a COVID-19 death and what's not. It says deaths caused due to respiratory failure after contracting COVID will be recorded, but it won't record deaths caused due to heart attacks or underlying diseases after contracting COVID. You must watch this.
Deaths caused by pneumonia and respiratory failure after contracting COVID-19 would be classified as COVID-19 deaths. Deaths caused by other underlying diseases such as cardiovascular disease, resulting in death for infected people, will not get that classification.
You heard that. Only deaths due to respiratory problems will be counted in the death toll. Deaths due to other factors will not. Why are we not surprised? When China can downplay the virus, when it can stop reporting asymptomatic cases, it can definitely change the criteria of COVID-19 deaths. The country plans to humiliate its own people, even in death. WION World is now available in your country. Download the app now and get all the news updates on the move.